Christmas right around the corner. A lot of people are very nervous about what it actually means for families gathering together to celebrate. So how can you best keep yourself and your loved ones safe from COVID? Well, let's ask Dr. Norman Swan, who's the presenter of RN's Health Report and the ABC Coronacast, who joins us now from Sydney. Thank you so much, Dr. Norman Swan. Now, let's start off with New South Wales. We're starting to see the cases there, the case numbers there start to rise. It's very concerning. Authorities, though, are pushing back against pressure to try to put more restrictions on. Should there be more restrictions, or should it be a case of, herd immunity? Is that what the authorities are trying to do?
Well, there's two things that are going on with the authorities. Remember, this is the government that gave us the Northern Beaches last Christmas, gave us the June outbreak, which then spread to Victoria, and the failed LGA strategy. So they don't, despite the hero status of New South Wales, they don't have a great track record. And there's this rhetoric at federal and state level now of individual responsibility. And that is against all public health principles. We don't have public health individual responsibility when it comes to drink driving, when it comes to childhood immunization, when it comes to seatbelts. We insist you've got to have rules in place. And when you've got a pandemic growing where we're not quite sure the nature of the Omicron virus, then that is a dangerous way to proceed when there are simple things that one could do to maintain freedom and try to avoid lockdown. Because if this goes pear-shaped in New South Wales and Victoria, the hospital system could really be under stress. If we get 25,000 cases, if New South Wales gets 25,000 cases a day as they predict, and it could well do so, you could have as many as 700 cases a day going into hospital. If you look at London at the moment, we've got a major surge going on. The number of people, health workers on furlough has doubled in the last 4 days, and they're predicting it could be 1 in 3 on furlough by New Year's Eve. And as you saw there from South Australia, our healthcare systems nationally are already under stress, independent of COVID.
Dr. Norman Swan, ATAGI is refusing to change the 5-month wait time in the vaccine rollout. How wise is that?
Well, you can tell how wise that might be, or the criticism that's going on behind the scenes, the fact that New South Wales is talking about going it alone at 4 months. There's a lot of frustration around about ATAGI. They're taking a purist evidence position, which is actually not actually an evidence-based position. It's more based on Israeli data, and Israel's a Pfizer country. The British data show significant waning of Astra against Omicron at about 15 weeks. And really, if you wanted to start, we, particularly Victorians, but also New South Wales people, really came forward to get AstraZeneca and are reasonably protected against hospitalization, but that's not entirely clear. We really should be moving to 4 months at a minimum, so that people who've had Astra, particularly those are older people who are more at risk, can be covered. Professor Alan Cheng at the weekend wrote an op-ed for the 9 newspapers saying we're playing the long game here in terms of ATAGI. Well, I think what we've learned in this pandemic is there is no long game. We thought we only had Delta to deal with over Christmas, and now we've got Omicron.
Just before you move on, I just want you to repeat something. You said AstraZeneca fades after 15 weeks. Is that correct?
So
I'm asking because I have AstraZeneca.
So do I. And so the data from Britain shows that the protection against, so I've got to be careful about this, symptomatic disease goes to 0 at 15 weeks. Now, there's almost certainly still hospitalization protection at 15 weeks, but protection against symptomatic infection disappears at 15 weeks. And therefore, there's a degree of urgency for AstraZeneca recipients to actually receive a booster just to give them maximum protection. It's likely hospitalization maintains for a while, but we don't know that for sure.
Dr. Swan, we have been told that we need to look at the hospitalization rates rather than the infection rates. And at this stage, yeah, the infection rates are definitely rising. Our hospitalization rates isn't that high as yet. But we have been told, too, that there is a time lag. When will that time lag reduce? When will the hospitalization rates start to pick up?
Well, if you look at Denmark, and this comes to the severity issue, we still don't know for sure whether this is a milder virus. You can't extrapolate from South Africa to Australia and other countries. Denmark has shown that the hospitalization rates are ticking up, actually ahead of where you would see it with Delta. And this is a virus that's actually doubling every 2 or 3 days. So we still don't know about the severity. So you could see hospitalization in New South Wales ticking up quite soon. Probably not to the extent that we saw with Delta, because people are immunized. But the problem is it doesn't take too many cases for the hospital system to be overwhelmed. And if you're going to go to 700 cases a day, that vastly exceeds what New South Wales, or indeed Victoria, experienced during the winter outbreaks.
What does this then all mean for Christmas? You know, we're all gearing up for our family gatherings, for our Christmas parties and not. Are you going to tell us that Christmas is cancelled?
No, I'm not. I think that there are fairly simple rules. First of all, I do think that there should be mask mandates. Small bars and nightclubs should be shut for the time being. They're high-risk spreading events. You saw that in South Australia. The world will not come to an end if nightclubs shut and small bars shut. Mask mandates, going back to QR codes and so on. But for Christmas, try and have it in a well-ventilated area. If you can have it outside, all the better, because the risk outside is incredibly low. And and try and keep people well separated with a well-ventilated environment. It's got to be inside, windows open, and a fan on to make sure that the air is circulating.